Hi guys, welcome to my YouTube channel. If you're new here, thank you for tuning in. Don't forget to hit the subscribe button. So today will be the final video in the breast cancer awareness series for the year 2020. Thank you so much to everyone who has liked, shared, dropped a comment, to everyone who has watched the videos in this series. I really appreciate. Thank you so much. So today Dr. Gbemi Peter-Ayeni will be talking us through breast examination, how it should be done, when you should do it, because really early detection is key even in breast cancer survivor. It has been discovered that the simplest and the cheapest method, I would say, key or factor even in reducing the incidence of breast cancer is breast examination. Yeah, it's free of charge. You don't have to pay for it. It's so simple, and yeah, it's free. So come along, sit back and relax and enjoy this video.
Welcome to this edition of the health awareness for this month. This is October, and we are doing a breast cancer awareness month. You could see the pink ribbon month all around, people using. Okay, so my name is Gbemi Peter-Ayeni. I'm a doctor in the UK. I work with the NHS, and I just want to show us how to do self breast examination. This is one of the easiest and it's a convenient means of detecting any change in your breast. As women, especially women of childbearing age, likewise women in their menopausal, doing a self breast examination is one vital tool that could help detect any abnormality, such as a lump or anything that could be sinister to a serious disease, probably a cancer. So it is usually advised that the best time to do a self breast examination for that who's still having their periods is between 3 to 5 days after your menstrual period. That allows that time the breast tissue is soft and without lumps, so it gives you a proper view to assess for any changes. And it's usually recommended that you keep to that every month, and that way you're able to detect any abnormal structure or feel anything abnormal in your breast. Likewise, for women in their menopause, it's advisable that they pick one day in the month, probably 1st of every month or 15th of every month, but they stick to that particular day of the month to do their self breast examination. So as you could see, I've got the female breast anatomy and pathology and all that. I'm not going to dwell so much on this today. What I'm going to dwell so much on is on how you can perform the self breast examination. So to start with, you need to stand in front of a mirror and with your clothes off, and just like this picture, you stand with your hands by your side and you look through the mirror to see for any changes. You're looking for any abnormal displacement in the nipple line. Normally there should be mild changes. Both breasts might not be the exact same size normally. However, you would detect any gross changes, any changes that are more than normal from your nipple placements, the size of the breast. You look for any dimpling, you look for any puckering around the nipples. So you put your hands by your side and you stand straight and you look at the mirror. So when you do that, you could see everywhere around. Then next, you put your hands at akimbo. You do like this, and this allows you to see if there's anything. You could also see any skin changes beneath the breast. You're able to see beneath the breast on either side when you put your hands this way. So these are the positioning you should adopt while doing a self breast examination. So once you do this, the next stage is for you to raise your hands at the back of your head, and you're looking at the mirror the same way. So you need to have a good view. This way you're raising your hands behind your head, and this allows you to see that any tissue that is shifted from the chest wall. So if there is a swelling or a growth or something, for some people you're able to see beneath, as you raise your hand up, you're able to see beneath the breast. You could see any abnormal swelling, anything that could point out to something sinister. So when you get to this stage, you're still observing, you're looking to see any changes that is not normal in your breast. So after this, for some people, you could some prefer to do it in the shower, but it doesn't matter. You could do it in the shower, you could do it while not in the shower. So the next stage is for you to take your left hand. If you're going to do the left breast, you take your left hand, you put the right below the breast, right, like this, as Justin is in this picture, and you put your other hand just this way. So you place your fingers around your breast. So it is advisable that you divide the breast into quadrants, as you could see from this picture. So it helps you to give you the views where you should palpate properly. So you could divide your breast into 4 quadrants, and the nipple stands on its own, and you come from the bone of the clavicle, just above the clavicle bone, because you could also pick any swelling, any lump in between the bones. So when you do that, so you're placing your right hand below your left breast, and you're coming like this. You're feeling softly, you're feeling gently, you're pressing down to feel for any abnormal changes. You know, we said that if you're doing this consistently, 3 to 5 days after your period, when your breast is less tender and soft to palpate, you're able to feel any abnormality. You already know the consistency of your breast tissues, and you could feel for any lump. So you press down gently, you press down, you rotate in circular motions around the 4 quadrants properly. Look at, I'm pressing my inner upper quadrant at the moment. So I'm going to press up and come towards the bones here, because I'm trying to see if there's any lump, any swelling, if I could feel anything in the bones of the clavicle. So you come downwards to the other side, you do the same rotation. You're feeling for any swelling, any lump, any abnormal changes. Sometimes they are very tiny, so it takes you to be consistent, so you're able to detect any little changes in your breast. So you do this for this same quadrant, and you come to this quadrant. So when you do all that, remember the armpit is also there, and the nipple. So what you do for the nipple is you try and press out the nipple to see if there's going to be any blood or any abnormal discharge. If you see any milky discharge and you're not lactating, that is also something to want to see your doctor about. And also you go to the armpit, you're still putting your hands by your chest, you palpate in between your armpit to see, because the tail of the breast goes into the armpits, called the axilla. So you palpate that way to feel for any swelling, and in the armpit as well. So when you do that, sometimes it might not be any swelling, it could be pain that you're feeling that is not normal. So if you're feeling any unusual pain or heaviness or anything in your breast, you're able to pick it up. So when you do that, you could also lie down. For some people, you might need to adopt a lying down position if that's more convenient for you, especially for women that are heavily breasted, that they've got large breasts. Okay, so it's easy for them to palpate through. So you can lie down with your left. If you're trying to palpate your breast, you lie down on the bed and you tilt towards your right to allow the weight of the breast to fall on your chest wall. So that way you go around the same motions that I've described across all the 4 quadrants as you're seeing here, and you palpate around it and around it. Something to make sure that this is effective is our consistency. You don't just do it in March and forget about it in April. So when you're consistent, it helps you to detect any abnormal changes, and when you notice any changes, then you know that you need to speak with your GP and schedule an appointment with you to see your doctor. So the same thing for menopausal women, the same pattern, the same way I've described it. The examination is the same way you go about it, but because you're no longer menstruating doesn't mean you don't do it. You just pick a specific date of the month and ensure you do it. This awareness is necessary because breast cancer is a disease that is very treatable when it's detected early. However, you need though there are screening tools, mammography, ultrasounds and all that, but then this is still said to be one of the most convenient and easiest way to pick any abnormalities. So I would advise that we get into the habit, we spread the message, especially for Black women in diaspora or back home in Nigeria. There's this thing about us that we don't take little self means to keep healthy, and these are one of the ways to break the myths and also ensure that we are caring for our health, we are ensuring that we're in good health, and we're doing all the necessary things we need to do to keep safe and keep faith. So I hope you've been able to pick one or two things. There are a lot of guides on the internet. You could watch the video, but I think this has explained the positions you need to take to do a self-breast examination. Start in front of a mirror, put your hands by your side, look through, put your hands akimbo, you're looking beneath the breast to see if there's any swelling, any coloring. For some people it could be coloring, it could be dimpling, it could be puckering, the nipple goes inside, unlike the way it should be normally come pointed out. So it takes you to get familiar with your breast for you to be able to detect any abnormal changes. Thank you for staying with us on this channel.
So I hope you've learned how you can do breast exam on yourself. It's very important to do it. Just try to, you can set a date on your calendar, on your phone. You can even like have a reminder to also remind your friends, your girlfriend, female friends, your wife, your sisters, about, you know, monthly breast examination is very important. And if you find or notice anything that, you know, is different from what you've noticed before, like in your breast, any changes, any lump, anything, just make sure you contact your doctor, you contact your healthcare provider, so that can be further, you know, assessed and investigated. So this concludes, you know, the breast cancer awareness series for this year, and next year be a greater and more interesting things to come. And if you've missed out on the earlier videos in this series, link will be in the description box, and so you can watch them later. So thank you so much, and I will see you later. Stay safe, stay healthy, spread the information and spread hope. Yeah, bye.